Good afternoon, everyone. Welcome to the Texas Balance of State CoC General Meeting. This is Cameron Fowler, CoC Director. We are thrilled to have you all on the line today and with us. Go ahead and let's pop up the map, Craig, and then we'll do introductions. As you all can see, I don't know if y'all pay as much attention to this as we do at every meeting, but we're continuing to see better coverage across our geography and even some folks joining us from almost out of state, and some other CoCs. We are happy to see coverage and engagement improving across our very large continuum of care and are glad you all are all a part of it. I'm going to go ahead and let the staff here on site with us at THN and Austin introduce themselves, and then we will also have our folks who are joining us remotely say hello as well.
Hi, I'm Kristen Zakor, the Data Coordinator.
Craig Blaze-Fierro, the CoC Programs Assistant.
Victoria Lopez, one of the HMIS Support Specialists.
Alexa Timmerick, Summer Vista.
All right, we've got a few staff off-site. You want to say hi?
Yes, hi. This is Jesus de Leon Serratos, HMIS Program Manager. Hello.
Hello.
Hi, this is Mary Ricklick, CoC Manager, coming to you from Texas City. And this is Caitlin Bearbow, the State Programs Coordinator, and I'm with Mary in Texas City.
Nice.
Thanks, y'all. Coming to you live from Texas City. Caitlin and Mary are in Texas City, which is very, very close to Galveston, and they're there for our org code trainings that will be there tomorrow and Friday. We're going to go ahead and jump into our spotlight for this meeting, and that is the lovely Karen Holt. Karen currently serves as the Housing Navigator for Community Health Corps through the East Texas Aging and Disability Resource Center. Y'all may know that as ADRC. She has over 20 years of affordable and accessible housing experience, specifically on Section 8, LIHTC, and HUD properties. Her role provides a wide range of knowledge, training, and advocacy on behalf of the elderly and persons with disabilities to developers, housing authorities, property owners, and the housing industry. She participates in the East Texas Human Needs Network and the Northeast Texas Homeless Coalition. They're two of the LHCs that we work with. Karen's also served in the past as a THN and CoC board member, and we're really excited to have her on today for you all to learn more about the work that the ADRC is doing in your communities. Some of you may or may not already be connected with the Housing Navigators. I'm going to go ahead and kick it over to Karen.
Thank you, Cameron, so much. Good afternoon, everyone. I am thrilled to be joining you and sharing with you a little bit about our Aging and Disability Resource Centers, as well as our housing navigators across the state. I would like to start out by kind of discussing what an ADRC is. An ADRC is in all 50 states. We have 22 ADRCs in the state of Texas. Their goal is to be highly visible and trusted and offer a full range of long-term services and support options. Our goal really is to empower individuals, families, caregivers, as well as professionals, providing awareness and assistance and access to federal, state, and local services and supports. We really focus on older adults, persons of all ages that have an intellectual, developmental, or physical disability, adults and children with long-term medical needs and supports, as well as adults and children with disabilities who are currently in or at risk of moving into an institutional setting. We also assist veterans with or without disabilities and caregivers for any of these groups. We believe that the best place for a person is at home in their communities. To do this, we do provide unbiased information on a wide range of aging and long-term services and supports. we really try to utilize a person-centered approach, and all 22 of our Aging and Disability Resource Centers across the state do have easy access. If you'll see on the screen, our main number is at the top. You call that number and you're going to enter a zip code, and it's going to direct you to your local ADRC. I will say all of our Aging and Disability Resource Centers do, their biggest core function is information and referral. We have calls daily ranging anywhere from rental assistance needs, utility assistance needs, help with prescriptions, medical or dental, individuals that transition out of a nursing institution, whether it be home health placements. We also provide long-term services and supports. The majority of our ADRCs do a lot of cross-training and outreach with partner agencies. A lot of our ADRCs are linked to your Centers for Independent Living, your local mental health authorities, and your area agency on aging. So my hope is that everyone on the call is aware of their local Aging and Disability Resource Center for their area. It is just a really valuable and huge resource that you can take advantage of. They're kind of like a one-stop shop. We do believe in the no wrong door approach. So you can again contact the number. Typically, most of the ADRCs across the state of Texas cover multi-counties. My ADRC is East Texas ADRC, and I cover 14 counties. So it just kind of depends on geographic area. So I kind of want to visit with you as well about what specifically a housing navigator does for the Aging and Disability Resource Center. That is what I do for our local Aging and Disability Resource Center. And we definitely have our hands in anything that has to do with affordable and accessible housing. We're really dedicated in increasing the portfolio of affordable and accessible housing, and then of course the options for people who choose where they want to live. Of course, we all know that is the #1 need is additional accessible and affordable housing. We really work closely with independent rental owners, local property managers. We also work with relocation contractors. Relocation contractors are those in the state that work directly with individuals that are in institutional settings that have Medicaid, where they are transitioning back into the community. So we work really closely with relocation contractors to help really facilitate those options that are available in the communities. We really advocate and educate developers as well as local housing authorities, any stakeholder, large or small, and local governments who wish to bring additional affordable housing into our state. Some good examples of things that our navigators work on is they really work closely with tax credit developers, providing them any type of resource that they potentially would need, whether it be letters of support, whether it be public comment for planning and zoning, or through city council to really support those properties in our community. We also work closely with the local housing authorities to ensure that there is preferences set for individuals that are aging and or persons with disabilities for their wait list, and that is definitely something that they have in their administrative plans. So we kind of work on the back side of things. We do not work directly with clients. That is something that our intake and referral specialists do. One thing that we do provide under the Housing Navigator program is we do provide an extensive housing inventory to our local aging and disability resource centers. So when clients call into our resource center and they have a need for affordable and accessible housing, we're going to have a go-to resource that's really going to cut out all of those properties that would not be considered affordable or accessible for someone that is moderate to low income. So I always like to tie this together because a lot of times I get the question, well, how does what you do relate to homelessness? And right here is in the nutshell of what I could say. Approximately half of the people experiencing homelessness in the U.S. are 50 years or older, and in the next decade, this number is projected to increase by 33%. I see this quite frequently in our communities through our point-in-time counts. I think a lot of this is due to many factors, but I think some of it is the just the aging population, your baby boomer age, as well as individuals do not have the savings and retirements like they used to. So people are they're living on a lot less. I think local leaders really recognize this in the aging in population, and I think affordability and accessibility really go hand to hand. So, you know, there's just a direct link to that with our homelessness population. So I always like statistics. I'm a big fan of having your facts and having your numbers because I really think that speaks volumes. Ultimately, our goal as navigators is to increase our housing stock, whether that be new construction, whether that be maybe an existing conventional property or a landlord that may not be willing to accept a local housing voucher program or a special supportive housing program, or even individuals that have a rapid rehousing program. That's kind of what we do, is we go out and share the facts, advocate for that, and then the hope is to get those landlords that have existing stock to start accepting those programs. And I can say for the East Texas area, we have a pretty robust group of individuals that really work hard on this. So again, 63% of seniors plan to age in their homes. The largest minority group is persons with disabilities. And older adults and persons with disabilities prefer receiving services that allow them to stay in their home, and that's just a fact. So I always like to bring this up, and I know Cameron and the crew at THN are very familiar with this, but again, I'm a numbers gal, and this is really what the navigators, we really utilize when we are advocating for affordable and accessible housing, and that is the Out of Reach report. And I know the 2017 just came out this week. I didn't have a chance to update my portfolio, but this is the national average on affordability and the housing wage, $20.30. I always like to show Texas. This just tells you that an individual has to make $17.60 per hour in order to afford a two-bedroom fair market rent in the state of Texas. If you'll see the number of hours worked, someone that is minimum age is 97 hours per week at minimum wage to afford a two-bedroom unit. So as you can see, it's definitely eye-opening. I'm sure all of us on the call, we know this. We live it and breathe it in our communities. You know, this affordable housing is a huge contributing factor to our homeless population. So hopefully the housing navigators can help out in that respect. I know I only had 10 minutes, so I know that was quick. So I guess I'll open it up to questions. If anybody has questions, type it in the bar there. Like I said, we do have 22 ADRCs. We do have housing navigators. I encourage if there is a individual that has a CoC funding, if you're on the call and you are with a local housing authority, and you do not know your navigator, I encourage you to reach out to your ADRC and find out who that is. They can be a great resource for you and a great help to you. And I just think that that would be a great partnership. I know that it takes great partnerships to really tackle our affordable housing issue. So hopefully this will be a good resource for you guys. And here's my contact information. I am in Longview, and that's my local office number, and then of course our 800 number. That's all I have, Cameron.
Thank you so much, Karen.
You're welcome.
And I see Roberta's asked, can we send the slides? Yes, we absolutely can send the slides out. And as Karen said, if anyone does have questions, y'all feel free to put those into the question box. But also just talking about affordable housing reminded me, and one of the resources we're going to share with you all today is a new study by the National Low Income Housing Coalition about just the cost of housing. And I know, and when I was working in Austin, we were fortunate to have a lot more resources in Austin than I know most of you have in your communities, but I wasn't even aware of the ADRC when I was working in Austin, and have seen and heard how helpful this has been to lots of communities that we do work with. So as Karen said, I would really encourage you all to get in contact with your local navigator if you have not already done so. I don't see any questions, so I'm going to go ahead and move on, but if y'all have any, we're always keeping an eye on those. And housekeeping, because I didn't do a good job at the beginning with it, if you have a question, you can always raise your hand or just type it into the question box and we will respond to that. So moving on to CoC current priority projects. As you all know, the CoC program application and competition is coming soon. We are waiting for the NOFA to be released. Could happen any day now. Want to remind all of our CoC projects that are renewals. Competition is technically already started because we've already done registration. So if you receive an email from us about renewals with a due date, please ensure that there's someone at your agency that's responding to that on time. We do look at responses to deadlines during competition as part of scoring. It's really important for us, because we're going to have so much to do, and you all are as well, that we get things in by the due date that we request them, and we certainly don't want anyone losing points for the competition for something like submitting something late. We're also going to be sending out an email this week to all of our renewal projects just confirming contact information, and we'll also be sending out, and this is already on our website, the score sheets from last year. Those will be updated for competition this year. Again, some of that we'll be able to do before the NOFA comes out, some of it we will not. Also, just wanted to take a moment to really strongly encourage those of you interested in starting a new CoC project in your areas to please consider applying for a bonus. We were able to fund 2 bonus projects last year, 1 rapid rehousing and 1 permanent supportive housing. We never know if we'll get bonus projects. We know how much they could potentially be, but it depends on how we score as the CoC on the application and how all of the project applicants score. And if you're interested in doing that, I would strongly recommend you start looking now at the HUD Exchange and looking at our materials from last year, our application, specifically our RFP. to get a good idea of the expectations that come along with running a project like this, because they're pretty high. I think our grantees would tell you that, and they seem to get more competitive and complicated every year. That's not because we want them to, but we really would like to see new projects come up across our geography, and would just encourage you all to keep an eye out for that. Once we do start having our webinars, again, all of this depends on when the NOFA gets released. We don't know when that will be. We suspect it will happen any day. We will do a mandatory webinar for anyone interested in applying, and depending on time, may also do one prior to that. So if you're coming to these meetings, you will be getting notifications about that. And I'm going to pass it off to Caitlin to talk about our written standards.
A little bit of a shuffle. Oh, okay. Sorry, y'all, we're doing this from a hotel room, so technical difficulties are always so much fun. So I wanted to give you guys an update on where we are with the CoC written standards. I'm pleased to announce that as of May 24th, the CoC board voted to adopt them, so we officially have written standards for service delivery in the Texas Balance of State CoC, which is really exciting. We've also decided on an implementation date. That date is September 1st, 2017. And just to remind everyone, CoC-funded projects are mandatory to adopt the written standards for service delivery. So we expect you guys to look at them. They're already on the website, but we will send out another email that has the direct link so you can download a copy for yourself. So that way you can incorporate them into your policies and procedures and any other documents that you have, such as an administrative plan. We also encourage our ESG recipients to take a look at them and to align their written standards as much as they can with the CoC written standards. One of the goals of the written standards as a document is to standardize how people get access to and receive services, and standardize the quality of services across the Texas Balance of State continuum of care. So in order to further the goals and be in the spirit of the written standards, we're trying to get as many providers as possible to adopt as much as they possibly can from the written standards. So that way, someone who's getting services in Abilene or Cameron County or Longview can all expect to receive the same quality of services no matter where they are. So that is our goal with releasing them. But also we are mandated by does anyone have questions? Oh, Cameron says I should call in. Are we having trouble hearing me?
Yeah, Caitlin, I would just re-hit those high points real fast or real slow. Your reception's not too good today. Okay,
I will try again. I apologize, everyone, because we're in a hotel right now and the internet does not appear to be fantastic. So I'll try again. Let me know if you can't hear me. The long and short of what I said is that the Texas Balance of State CoC written standards for service delivery were adopted by the board on May 24th. As a reminder, all CoC program-funded projects are required to adopt the written standards and to comply with the written standards. We've set an implementation date, which is September 1st, 2017. So we expect your policies and procedures and any other documents you have, like an administrative plan, to be in compliance with what appears in the written standards as applicable to your project type by September 1st, 2017. Also, a reminder, we are asking our ESD or Emergency Solutions Grant recipients to align their own written standards with the CoC written standards. And this is so that way we can standardize services across our geography. We want people experiencing homelessness in Cameron County or Longview or Texarkana or Lubbock or Abilene to all be able to receive the same quality of services and to know what to expect from homeless service providers across the state. So that's our main goal in trying to, roll out the written standards. Of course, we are also mandated by HUD to have them, so there's that. We're also asking as many non-federally funded providers as we can to adopt as much of the written standards as they can in order to align with this goal of making sure that we are transparent in the way that we provide services to people experiencing homelessness. Anything that you wanted to add, Cameron, or anything that got cut out that you guys were not able to hear?
No, I think you covered it.
All right, great. Well, we're really excited to roll these out for you all. Stay tuned. They are currently posted on the website, but I imagine we will also send out a email with the link.
Yes. What she said. Yeah, we posted them on the website. We'll also be sending out an email, and I'll just roll right into coordinated entry written standards, which were also approved by the board on May 24th. Implementation date for those is now, and it's immediate incorporation into your CE planning. So when your community submits their plan to us by September 1st, that's the date the last possible date that communities that are CoC and ESG funded and mandated to participate in coordinated entry can submit their community plan to us for review. As you all know, we hope by now, we've got a date in January. This does not mean you need to wait until September 1st to submit your plan. The sooner we get it, the sooner we can give you all feedback, and the sooner you all can get moving on this in your communities. Sophia is going to be doing a webinar to review these on the 22nd of June, I think. Is that on the calendar? This is the perfect time to talk about the calendar.
So if you weren't aware, we do have a community training calendar that is on our website, but I'm going to send out its permanent link when we send out the materials. You will always be able to check this no matter what sort of email server you have. It's going to show every training we're doing, plus additional trainings we think would be beneficial for you. If it's a closed audience, inside the description, like I'll show you, Sophia's here, her book club. Check out more details. There's nothing in here because it's a closed audience, so I need to actually go fix this one up, and it'll show you email Sophia for those details. It's the same with all the HMIS ones. Bam, bam, it's got the description. If you need that information, it shows you who to get it to. Anything that's open to the public, all of these meetings will be on here as well, like today's was on here. So if you never forget to register, you don't get those emails, you got no excuse, they're right here because I'm going to send it to you later today. I have scheduled all the way through October, so we are good for our fiscal year, and I will restart come September 1 with the next one, but it's going to be added to the same thing, and we'll be good to go. So again, I will send you this link. Please bookmark it, save it, send it to all your friends. It's the best thing you're ever going to see. But I'm going to put everything I possibly can in this thing just for you because we appreciate you. But yes, September 22nd is Sophia's next webinar.
Got it. Thanks, Craig. And just want to clarify because we have a question from Chad.
Are they the same dates?
And this is why it's hard when Sophia is on vacation. We'll review, and I'll probably ask someone to pull up Sophia's last email. I'm fairly certain that the plans are due to us by September 1st for coordinated entry. If anyone has already implemented or is in the process of implementing, which no one has fully implemented yet, then they need to be incorporated as soon as possible. For the CoC written standards, that drop dead date is September 1st. And we're going to review Sophia's email, and we'll let y'all know. I'm fairly certain those are the correct dates.
Mm-hmm.
And disclaimer, y'all, I've been in Corpus all week, and I rolled into the office about 20 minutes before this meeting started, and I also got pulled over on the way back. So just sticking with our transparency theme. If I'm a little off today, that's why.
It's been a travel day.
It's been a travel day.
Um,
I also told staff today that, and a lot of you may know this and some of you probably don't, because how would you? Because you don't ever see us. I am pregnant and started my 3rd trimester today, and it was the first time I used the pregnancy card was when I got pulled over, and I didn't get a ticket. So it worked out well.
Chad's got a good one.
Chad, we're not requiring LHCs to formally adopt the standards. We highly, highly recommend it, especially for those communities that are receiving CoC and ESG funding. I think it would be really challenging for you all to have certain projects in alignment with the standards and others that aren't, especially as you're moving towards system work that involves coordinated entry. Chad has also asked the best way for us to for LHCs to communicate to us that they've adopted or implemented them. We are going to provide more details on that. For CoC funded projects and ESG projects, you can send us your policies and procedures and we'll be able to see that you've adopted our standards. For LHCs that do choose to adopt, which again we highly, highly, highly encourage, you all can just send us that vote. And we'd also review it in your LHC meeting minutes. Does anyone else have any questions on written standards before we move on? Okay, and as with all, y'all can keep those coming in. There's no time limit on them. I'm going to go ahead and move on to data, and Jesus is going to share with you all about some webinars coming up from the HMIS team.
Yay! Hi, everybody. I'm sorry, I was trying to finish the candy before my time.
And you did.
Okay, I got it. They were trying to convince me also to go live with a camera, but no, I actually only do that during our HMIS webinars. That's one of the reasons why you guys should join us. You get to see, well, not me, just you see the HMIS team, and that is actually, it has worked really well, we feel, even though we are not truly seeing you, we feel a little more connected. And it is, I don't know, maybe you guys see us and they say, well, I'm not talking to a robot. I can ask a question to these guys. So that's pretty much what I'm doing here. I told Cameron a few months back, I think I need to go to your webinar and ask them to invite everybody to join us. Because we have a lot of really good information that we constantly sending in there. And as you see right now in the calendar, this next session is the 6th session. We started this. I like this. We started this season in January, and we're having a webinar every month. It's always the same. Well, it's not the same date, but it is actually the last Thursday of the month. So you can put that in your calendar. Just go in your calendar if you don't, I mean, you're gonna have in the calendar that Craig's gonna send you is gonna be there. But if not, I mean, just remember it's the last Thursday. And sometimes like this month, there's 5 different Thursdays. So it's actually on the 29th. But before that, the other webinar that I wanted to invite you is actually a training that we're gonna have next week. And this is on Friday, the 23rd. It's going to be at 1. We usually try to have everything at the same time to keep things easy. So it's going to be on the 23rd at 1 p.m. And what is this training about, you might be asking. We're going to have actually an assessment training webinar. Why are we having this assessment training? Well, we have been, and you're going to learn a little more about what we've been doing recently, because Kristen is going to talk about system performance measures. But we're constantly trying to find ways to improve the performance of our users, trying to bring out new ways, new interactive ways, new training, learning tools to keep it entertaining. But we noticed this time that there was an issue going on that a lot of people were not aware of the need of continually doing an assessment. Most people think, well, I enrolled a client, I create an assessment, that's the entry assessment, and that's pretty much it. I mean, like, I don't have to do anything else until I exit that client. And in most cases, it's true. If the client stay there for maybe like a couple of days, you do one entry assessment, and then you do an exit assessment when the client leaves your shelter. But for most programs, that's not true. There's a lot of programs that we have where the client actually stays for longer than a year. And in those situations, you do have to do an assessment every year. Why is this? Why, if we already collected the information once, why do we have to do it again? And I'm obviously asking all these questions because that's how my brain works. Why do we have to do this? The reason is very simple. When you enter the client the first time and you conduct that first assessment, well, you're pretty much telling us the characteristics of the client at that precise moment. And those conditions change. I mean, the client can obtain a job in 3 months after enrolling into your program. And that is, for example, that's a very good information to have. I'm not saying go back into your first entry assessment and add this new information, because that will pretty much eliminate your first assessment. And I don't want to complicate it. All of this is going to be explained in detail during the training. But this is why, because if you don't track every year, pretty much the reports work for a year. Let's just say it like that. If next year I have to run a report, you have to run a report, you might find that some of the clients are not being counted. And why is the reason? Well, because there is no assessment. So the report pretty much takes the information of that year. And if there is no new assessment, well, the client could be enrolled, but it's not going to show up in your report. And that's pretty much what we want to do. We want to make sure that everybody knows these things. And if this was my webinar, I mean, we'll probably have polls in here to ask questions. I mean, do you know what types of assessments we have, right? Because it's not just entry and exit. We have a during program enrollment. We have an annual enrollment. If I ask you what other possible assessment situations we can encounter, all of that will be taken care of. Again, I'm going to repeat the date is June the 23rd. The invites haven't been released. We're actually going to send them today. And this actually is going to be divided into training. We're going to have the training twice. The first time, which is on the 23rd, we're going to have it just dedicated for CoC projects, ESG funded projects. Pretty much like every project that is funded, federally funded. So those are the ones that are going to receive the invitation. Why I'm saying this is because if you have one of those programs and you don't receive an invitation, it's probably, well, we don't even have your information because we're obviously only sending it to people that are active in HMIS. But if you need to have one or you need to attend the webinar, please email the HMIS help desk so we can add you to this webinar, because this is one of those examples that Craig was saying. This is a closed webinar. This is just for HMIS users. But if you feel like you have to be there because your grant requires you to monitor this, we want you there. So just email us at hmis@thn.org. So that's it pretty much. June 23rd, assessment webinar. Invitations are coming out today, and our regular session, the HMIS 6th session, coming up in June 29th. Again, those invitations haven't been sent either, and we don't send those until a few days before, because we actually have to create our invitations based on the actual users of HMIS. So we have to go and see what current users we have. So if you started HMIS yesterday, I mean, you will be included in this new list, because we can't send it every day. We every month we lose some users, but we gain some new ones. So that's the reason why we don't send them way in advance. but just put it in your calendar. Last Thursday of every month. That's pretty much my time. Thank you very much.
Thank you, Jesus. I've missed your voice in the office.
Are we unmuted?
We're live.
I miss you guys too.
Also, for CoC and ESG funded projects, really, and for all of our users, these assessment webinars are going to be, this training is mandatory, is not optional. We also recognize we could have given you a bit more notice on the Friday one, CoC and ESG HMIS users. If you can't attend this one, will have the option of attending the later one, but these trainings are going to be mandatory for all HMIS users. And on that note, I'm going to pass it off to Kristen to talk about system performance measures.
Hi, everyone. So I am going to delve in a little bit about system performance measures. I'm going to first start off with just a quick explanation of what they are. For those of you who don't completely understand it, so system performance measures are system level data that allow HUD to understand how a CoC's and, am I echoing? Oh, sorry guys. Alrighty. I'm going to start again just because I think it was kind of a weird echo here in the room. So anyway, SPMs are system-level data that allow HUD to understand how a CoC's entire system of homelessness, or homeless assistance system is performing, and they also factor into our CoC application. They call for initiatives and programs to be understood in relation to what they contribute to the overall goal of reducing the number of homeless individuals. The measures are based on HMIS data, and most of them reflect the full system of homeless assistance available regardless of the funding source. And then also, since the victim service provider projects cannot be entered into HMIS, they are not included in the calculation of the system coverage. So that's just kind of a snapshot of what SPMs are. And we're actually going to look at this particular Excel chart in a minute, but I just wanted to quickly give you guys a summary of kind of what happened this year for this round of submission. So first of all, I want to give a huge kudos to Jesus and his HMIS team and all the effort that they put in to get this done. I know it was a very intense task for them, so I want to thank them for just all the hard work that they did. Unfortunately, since I'm new, I wasn't able to get my hands dirty with this particular round of submission, so they did an amazing job, and they ended up submitting it at the beginning of this month on the 5th. So once again, thank you guys for doing all the cleanup and entering this information into HDX. Also, just to note that HUD offered the ability to resubmit fiscal year 2015 data this year, and that was due to some challenges that different CoCs faced last year of entering data, and so they offered that up, and we went ahead and took advantage of it. And so we resubmitted our fiscal year 2015 data just to make sure that HUD was receiving the most accurate information that we had in our system. So that means that this year, this round of submissions, we submitted both fiscal year 15 and then fiscal year 16 information to HUD. Also, something new for this year was that HUD required that we use a system performance measure data quality report. And so that data quality collects a few of the data points that are from the HMIS data quality report, if any of you are familiar with that. And for this year, it was required that we pulled those for all the project types and from 2013 to 2016. So it was, now you know why I'm rough, so grateful for our HMIS team. They had to go back and do a lot of cleanup. I'm sure a lot of you guys were in communication with the HMIS team, so I appreciate the patience and teamwork that we everybody had in getting this done, because it was a very huge endeavor, but thankfully next year we will only be required to submit 1 year of that data quality for the different project types. So next year hopefully it will be a much smoother process, and a much more streamlined process, and everybody will be happy. I do kind of want to piggyback on what Jesus was saying, just about the importance of completing assessments with your clients. It's really important that we are updating that client information when necessary, just because if this is done on a regular basis throughout the year, it helps to improve the overall data quality and allows for a more accurate picture of what's happening within our system at any given time. And that also goes for, for you all as well. If you need to run a report, it gives you a better idea of what's happening at any given moment for your particular project. So please just do keep that in mind. I know the training is going to be really beneficial that the HMIS team is going to put on. So take some good notes, and then hopefully we can try to implement that consistent follow-up and assessments as we move forward. So now we will go ahead and take a look at this. I'm not going to really delve too deep into this information right now. So essentially there are 7 measures that are in the system performance measures. Measure number 6 isn't applicable at this time. So technically we're only looking at 1 to 5 and then 7. But I just kind of wanted you guys to see essentially what the desired changes, and then looking at this year-to-year, comparison. So we can see that, comparing fiscal year 15 to 16, we have more green arrows than red arrows, which is good. That means that, we were able to kind of move in the right direction with these measures. Like I mentioned, we're not going to go too much into this right now because Cameron and I are going to work on a deeper analysis of this information, just so that we can kind of get a better sense of what's actually going on in our system. And also, since we don't have CoC-wide benchmarks, we can't really come up with a conclusive determination of whether or not we're actually meeting all the measures and everything looks dandy. It's because we're still in the beginning process of everything. But I just wanted to show you guys this quick summary page of the measures, just so you can get an idea of what's going on. And then, like I said, we're going to be working on something more in depth, and then we will definitely keep you all updated with that information. So that's all I have for the system performance measures. And then I just wanted to quickly touch on the, yes, sorry. We had a staff member raise his hand. I just want to quickly touch on the PIT webinar that we held at the end of last month. And it was just held to go over kind of how the 2017 PIT count went for each community, and then also talk about improvements for the upcoming PIT count. It went well. I sent out the recording to those that participated in the webinar, and if anybody's interested in listening to that webinar, it is a private link, so please do email me and I can get that to you, so you can send it to any of your staff members or anybody who's interested in listening to it. And as always, this is a very an intense process for me, since I'm also new at doing this, and I just want to make sure that I'm really getting an understanding of your feedback and making sure that we are improving this process as much as we can for next year. So please, if at any time you just have a thought or a comment about what we can do better for next year's PIT count, please just send me an email, and I'm more than happy to kind of engage in that conversation and figure out what we can do best to support your community and the overall process.
Thanks, Kristen. We'll be talking to you all a lot more about system performance measures very soon, and we'll probably do, and I probably said this at our last meeting, a webinar just dedicated to system performance measures. As she said, as you all can see, we have more green than red, which is good. There's so much that goes into these, and so much historical data that plays into them, and we're more than halfway through what will be our 2017 measures. So another thing we're working on is what our ongoing process is going to look like for these. For us as a CoC, I know I'm sound like a broken record, very different with our coverage area than it is for a smaller CoC. We are still working with HUD, our HMIS vendor, Ecovia, our HUD TA, and I know Kristen and Ben spent a lot of time this week looking at the SPM report to figure out the best way you all can be looking at your community locally and your project locally. And we're working on that. When these were designed, no one took into consideration large COCs. And on that note, and this is also exciting news, I had a call late last week with all of the HUD CPD directors, which never happens, just to talk about the challenges that we're facing as a large balance of state. They are reaching out to all of the balances of state, but are paying particular attention to us because we are the largest continuum of care in the country, and are really looking at how they can better assist us to better assist you all and how we can overcome some of these challenges to our size. So it's exciting that they reached out and that they're really wanting to hear from us. We're also planning to have another meeting at the NAH conference with all the other balances of state to just share solutions. But was really happy to see the returns to homelessness decrease, the total number, and then the number of newly homeless. We know already that number 2 is going to go up for 2017, just based on our point in time. But we also know that that's because you all out there are doing a really great job on your point in time count and making that as accurate as it can be for a point in time count. So looking forward to working with you all on these a lot more in coming months.
And I just noticed the measures are numbered. I forgot to put the numbered a little strangely right now, so sorry. That's not how it is. You will get an updated and correct version later on.
Math is hard.
I'm sending out a chat to all of you, but I'm going to say this as well. Just to confirm, as I previously stated, it was correct. The written standards for CoC standards must be implemented by September 1st. CE, they're effective immediately for planning purposes and must be incorporated into community plans, policies, and procedures. Community plans for coordinated entry are due to us by September 1st at the latest. Coordinated entry per HUD and thereby us as the CoC must be implemented no later than January 23rd. Again, if you're working on coordinated entry in your community, I hope you're already in contact with Sophia. I hope you attended our Systems Change Toolkit webinars. If you didn't, I highly recommend you attend the webinar on the 22nd of this month. And if you're in a community that receives ESG or CoC funding, if you're an ESG or CoC funded project and you haven't heard about the work in your community on coordinated entry, you should be concerned and let us know and be working with your coalition and our other community group on this as soon as possible. Again, I'll be sending that out in a chat so you all have it in writing as well. And I am going to hand it off to Mary to talk about consolidated planning. I'm hoping our sound is a little better.
Hi, Mary.
Hi, can you hear me?
Oh, beautiful.
Great. I just wanted to quickly go over some LHC requirements. These were also approved by our board at their May 24th meeting. They had a big meeting on the 24th and passed a lot of policies, and this is one of them. The LHC requirements, we just updated them, made some proposals to the board based on things that we were hearing from all of you and some updates that we knew needed to happen. So I'll just quickly highlight the changes. The first one is that first underlined area that says LHC chairs. We have added the requirement that LHC chairs must attend CoC general meetings or have a designated representative to attend in their place.
We had made that clear to the LHC chairs, but it wasn't officially in the requirements, so now it is. The second change is in the data and performance section. We mistakenly had not included housing opportunities for persons with AIDS or HOPWA in the list of sources of funding that if your project receives it, you are required to use HMIS. So that was just an omission on our part, and so we've added HOPWA now. So that should be the entire list of programs that require their funded projects to use HMIS. And a little further down in the PIT count section, we made a clarification that we would like all communities to inform THN of any changes to their PIT count lead person within 24 business hours. So that's what Kristen was just talking about a moment ago, the PIT count leaders in the communities that she works with directly as we're conducting our PIT count across the balance of state. We want to make sure if your PIT count leader in your community changes, that you please let us know within 24 business hours so we can keep moving and planning productively with the right person. The second thing under PIT count, we just clarified that the date, it had formerly said something like conduct the count on the designated day. So we added a phrase that says as annually determined by the TX BoS CoC. And I believe we have already chosen our date for next year. You were a part of that because we did a poll question at a prior meeting. All right, then the last update was the most significant, and it was the coordinated entry section. We updated the entire section based on where we are with coordinated entry now. So let me just point out a few things. Some of this is what you just heard Cameron talking about. LHCs that cover communities that have CoC program funded projects and or ESG program funded projects must ensure that their communities develop a coordinated entry process because those projects are required to use it. While HUD mandates that the agencies receiving certain funding sources participate in coordinated entry, homelessness cannot be ended by these providers alone. It takes all providers in the housing crisis response system, regardless of their funding source, to end homelessness. Therefore, all communities are encouraged to develop a coordinated entry process. So the LHC must vote to approve a CE planning entity to manage the local coordinated entry process implementation. Examples of CE planning entities are LHCs themselves, committees of LHCs, United Way, or a mayor's task force. So we want to be flexible with your community and let you choose which group will be your planning entity. It's just that the LHC must take an official vote to approve that planning entity. And also, the LHCs are required to include coordinated entry as an agenda item to be discussed at every regularly scheduled LHC meeting. So clearly the theme here is that coordinated entry is important, and we want to make sure that local homeless coalitions are, if not the planning entity themselves, at least very aware of what's happening with coordinated entry and discuss it at every one of their meetings, because it really is systems change and the extreme planning that we are trying to do as homeless service systems for the benefit of the program participants and people seeking assistance. So these requirements are what we expect local homeless coalitions to meet in order to continue being considered official LHCs of the Texas BoS CoC. These are on our website, but if you have any questions about them, you're welcome to contact me. This is Mary, the CoC manager, and my email is mary@thn.org.
Awesome. Thank you, Mary. Switching back. Alexa, you ready?
Mm-hmm.
All right. Go ahead.
Our our Summer Vista. Alexa is going to share with you all about our local Homeless Coalition Toolkit. That's her project she's working on with us this summer. We briefly touched on it at the last meeting, and she's going to share some more details with you all.
Just talk to them.
Hi, as Cameron mentioned, my name is Alexa. My Vista project this summer is entirely focused on creating an LHC toolkit that can be as helpful as possible to local homeless coalitions in the Texas Balance of State, CoC. So this is just kind of a brief overview of what that toolkit is going to look like. I sent out a needs assessment survey last Monday, and the answers from that have informed a lot of what's been included in my toolkit so far. And the surveys that continue to come in are going to inform what gets added to it. So I want to thank everyone who has responded to the survey. And if you haven't had the chance yet, next Monday is the date that I'm going to really be incorporating the responses I get. So if you could respond by then, that would be ideal. So just a quick overview of what's going to be included is on the screen right now. And if you have any additional suggestions or questions related to the toolkit or information that you think would be useful, please feel free to contact me at vista_Alexa@thn.org, which is on the screen right now. My time this summer is dedicated to ensuring that this toolkit is as effective and useful as possible. So any information you can give me that will help me accomplish that task would be really appreciated.
Thanks, Alexa. Yeah, again, I would just echo what Alexa said. Y'all, please, if you're an LHC lead or a lead community entity that's not even a coalition that's working on ending homelessness in your community, you would have received an email from us. We've received a lot of requests to do something like this. That's why we were very lucky to have found Alexa to work on that project this summer, and it's for you. So I just really encourage you all to please participate in this survey. And if you have any other ideas, please just contact Alexa directly. We want to make this something really useful for you all and are doing this project based on requests from our coalitions. And Mary is now going to talk to you all about con planning.
All right. So as a continuum of care, we are required, as are all COCs around the country, to coordinate our planning with consolidated plan jurisdictions. Those are groups that also get HUD funding, CDBG or Community Development Block Grant, HOME or Home Investment Partnership Act, HOPWA, Housing Opportunities for Persons with AIDS, and or Emergency Solutions Grant, which is ESG. So a consolidated plan jurisdiction may get one or more of those 4 sources of funding. And it's all about community development. So a large part of the focus is on building affordable housing, developing infrastructure. As Craig and I have been going through consolidated plans from around our COC, we've seen a lot of money dedicated to things like sidewalks and water systems. So we want to coordinate and collaborate with the con-plan jurisdictions to help them see how some of their funding could be dedicated to addressing homelessness in their communities. And then conversely, in their consolidated plans, those jurisdictions are required to do not only a housing needs assessment, but assessments for housing for special populations, one of which is people experiencing homelessness. So HUD has outlined a number of ways that COCs and consolidated plan jurisdictions need to coordinate and collaborate. So we wanted to give you a little handout here. In case you're not already working with your consolidated plan jurisdictions in your area, there's a list of them at the bottom. So all 40 of those entities get one or more of those sources of funding that I just described. The names that have an asterisk next to them do in fact receive Emergency Solutions Grant funding or ESG funding directly from HUD. So that is a huge source of funding, particularly for homeless services, particularly for street outreach and emergency shelter activities. So there, if you are wondering if you have a consolidated plan jurisdiction in your area, of course the state of Texas is one, and their funding for ESG comes through the Texas Department of Housing and Community Affairs, or TDHCA, and the HOPWA funding comes through the Department of State Health Services, and the CDBG and home money, oh no, TDHCA has home money. The CDBG money comes through the Department of Agriculture. And then for those 7 jurisdictions that get ESG that are not the state, we have 4 cities and 2 counties. So we wanted to make you aware, if you're not already, of what those common plan jurisdictions are and encourage your LHC to get involved with them on joint planning. In that we are required to consult with them too, we sent out a big survey to these common plan jurisdictions, reminding them of what our coordination requirements are and also asking them how we can be most involved. So we don't want the CoC only to be involved with them, however. We want all the LHCs, or even if your community doesn't have an LHC, you can still join your consolidated planning process. So thank you to those common plan jurisdictions who have already responded to our survey. For those of you who haven't yet, they're due on the 19th.
Thanks, Mary.
I think that's it.
I'm actually looking at the list. So y'all can see the list of everyone we're expecting a survey from. I just wanted to go ahead and thank those that have completed them thus far. Brazoria County, Brownsville, Denton, Galveston, Harlingen, Hidalgo County, New Braunfels, Port Arthur, Sherman, the great state of Texas, Williamson County, and Corpus and Lubbock we received today. So that's still quite a few outstanding. I know the deadline has not passed. I know I frequently don't submit things until the deadline or a day or two before. Just so y'all are aware, consulting with the CoC for common plan jurisdictions is a HUD requirement. We're working a lot more closely with them on this particular planning issue this year. And we are going to be informing HUD if we don't hear from you all. So, and we want to hear from you all. So thanks, Mary. And again, those surveys are due back to us by the 19th.
Yeah, the survey will shut down the 19th at 5 o'clock. If you do know any of your CDBG, ESG, home, HOPWA contacts, just reach out to them and say, hey, have you seen this survey? Do you know about this survey? And if not, send them to me. I'll make sure they get wrapped in because we want as much input as we can across this 215 county jurisdiction that we can get.
And we're using contacts from HUD that were updated in May. So we're hoping most of them are up to date, and I think any bounce backs we received, we resolved pretty quickly. I think that's it, Craig.
Actually, this is Mary. I wanted to make one more point. Craig has done an amazing job of researching those 40 con plans, and then in some cases additional action plans that are the one-year plans within the 5-year consolidated plans. So he is very familiar with what's already in them, and we see some places where we know that we can be more helpful to the con plan jurisdictions than not. So we're looking forward to getting more involved.
All right. As you all probably know by now, we've got quite a few staff members going to the National Alliance to End Homelessness survey. Am I totally, I'm not here apparently.
You're still in Corpus.
The water was really nice, I have to say. Org code training. So I just got back from Corpus. We did our amazing emergency shelter and housing stabilization trainings. Org code did primary facilitation, and they went quite well, as they did in Abilene and Denton earlier this year. It was great to see a lot of you there. I see some of you are joining us today as well. The feedback we got was really good. Heard from several folks in Corpus that and it was good they didn't tell me they were tired of hearing me talk about housing first, that they feel like it's really finally starting to sink in and that repetition seems to be helping. So that was good feedback to get. Mary and Caitlin are in Galveston now, actually technically Texas City, and they'll be joined by Zach Brown and Jeff Sandell, who are going to be the primary facilitators for training there. We're really excited to be in Galveston and Texas City, and as well to have been in Corpus this week. I wish I could be there, but I learned that right now week-long trips are not the thing for me. So look forward to hearing how those trainings go, and also wanted to let you all know that I have some, I think, is exciting news. I think y'all have heard, those of you who attended Abilene and Denton, and those of you in Corpus, that we're going to also be doing some follow-up webinars with org code and sitting down with them in Corpus this week. And the original plan was to do 4 webinars on emergency shelter and 4 on housing stabilization, and just talking through some of our needs and kind of seeing how flexible they were around what those webinars could look like. We found they're going to be quite flexible. And while we're going to do some follow-up on emergency shelter and housing stabilization, we're going to also address some other needs that have come up frequently that you all have requested for trainings. And we're actually going to start our first 2 off. We're going to be doing trauma-informed care and motivational interviewing. And we're really excited about that. So stay tuned for that, and those will be open to anybody in the CoC. You didn't have to attend the trainings that we've been able to put on in person with org code. So keep an eye out for that. And Mary has some more, well, related ESG updates.
All right. State ESG is still in process. Also still in a holding pattern though. Again, we are the lead agency for our CoC, and so we play a role in applicants applying for TDHCA's ESG funds, in that we consult with the applicants on project design, budget, and performance targets. And we also complete the Attachment A form as part of the application, and it verifies the participation of applicants in our CoC general meetings, like the one we're having right now, in the point in time count, and in coordinated entry. As of today, we had a few applicants decide not to apply, and so we've got now 21 applicant projects that are requesting approximately $7 million. Our allocation, however, is only about $1.7 million. So there are going to be a lot of projects that aren't going to receive this funding, but we do hope that with the project design work that we're doing with them, they'll have a project that will be appealing to other funders as well. And it's great for community planning. We've gotten a lot of collaborative applications where more than one agency from a community is applying as partners with others in what TDHCA calls a collaborative application. I have copied the entire email that we received from TDHCA on May 18th down at the bottom, and it specifically says 2 things that I think are the most important. TDHCA will set a due date for application after HUD releases TDHCA's allocation. So the federal government approved the FY17 budget on May 5th, and HUD has 60 days from that day to award allocations. So TDHCA will know sometime between now and July 5th what their allocation is, and then they will be able to tell all of us and set the due date for application to TDHCA. Because this is so much later in the year than they had anticipated, they're now assuming that the contracts will start December 1st instead of September 1st, which was their original timeline. So just know if you're applying for this funding, the contract might start later than they anticipated. For those of you who have current contracts, there's some information in the email about extending your contract, your current contract, so that you don't have a gap between that current funding and potential new funding. So you'll want to make sure that you're staying on top of the most recent developments in state ESG. For those of you who are applying this year, I do have consultations scheduled with a few more of you. Most of us have wrapped up. Some of us are wrapping up, and a few of you are still needing to do some consultations because you had adding partners and needing to do procurement and things like that. So that is the state ESG update. If you have any questions at all, you're welcome to contact me and we can talk through them.
Thanks, Mary.
Actually, Mary, we do have one for you. If the contract would start December 1st, would that mean it would end November 30th, 2018? Or is that depending on the contract they have with TDHCA?
You know what? I don't know what the end date would be. I don't think that the email said what the end date would be. I could imagine that they might try to end them on the original due date or original ending date so that they can start the next year and the time frame that they wanted, because this NOFA, or this RFP, sorry, was for a 2-year contract. Okay. And so whatever happens now will affect not only year 1, but potentially year 2 of the contract. So I don't know that for sure. We'll have to keep listening to what TDHCA will be telling us in the next few weeks.
Alrighty.
Thanks, Mary. Caitlin, financial management training.
Sure thing. There you are. So I wanted to remind everyone that this resource exists. Financial management curriculum. This is one of the findings we find most often with our federally funded projects. So that'd be CoC funded projects, ESG funded projects, and even for projects that don't have a homeless service component, such as your CDBG grants, your home grants. Those are all what are called HUD CPD grants, and this financial management curriculum is specifically aimed toward people who receive those CPD grants. So there is, I want to say, 3 different trainings that you can go through. There's Financial Management 101, which gives you an introduction to sort of the general requirements that HUD has for CPD grantees. There's Financial Management 201, a closer look, which goes into some basic cost principles. And then the very last one is Financial Management 201 Part 2, Examining the Parts. And that gets into the specific program regulations for home, CDBG, HOPWA, ESG, and the Continuum of Care program, or CoC. Again, because this is an area that grantees of all programs tend to get a lot of findings in, we really recommend that you, and by you I mean project managers and especially your finance department, go through these trainings. They're very interactive, and I found them to actually be, dare I say, enjoyable, but that might just be because I'm a nerd. They do a really good job doing these online trainings. They do a good job making them engaging and explaining things in a way that is easy to understand, and it will also help prevent your programs, projects from getting findings. So just wanted to remind you, it's here. I would encourage you to maybe work through it 15 minutes at a time over lunch. It really isn't that bad. It's not that scary, and it can also help your project look really good to HUD to help you continue to get funding. Just want to let y'all know it's out there.
Thanks, Caitlin. And yeah, y'all, 101 and 201 are really good regardless of your funding source. They're just really good basic financial management training. So, and can't always say that about things that HUD posts, but this one, it's pretty good.
I did put that link in the chat bar if you are interested in those trainings. Moving on. Oh, poll time.
Poll time. As you all probably know, we've got quite a few staff attending the NAEH conference in July. I will not be going this year because I cannot fly. There was an idea thrown around about an RV and a van, but it doesn't sound very practical. So we wanted to throw a poll out there to see if any of you all were going to be in DC in July with us. And Craig is going to launch that
Let's go.
now.
It's about 30% voted.
Yes, this was the very important poll.
This was very important.
That Craig said would be coming to you during this meeting.
Everybody had their finger itching to answer this question. It's about half of them. If we don't know you're going, we're not going to stop and say hi. We've got a few more seconds. Looks to be about a minute. All right, let's see this. We've got 49% saying I wish, who's paying.
Yeah, that one.
We have 45% saying no, and 6% are yes. So we will check out this list to see who is actually going, and we will make sure we stop and say hi, especially with our NAH meeting. Y'all should. Never mind.
6% of, do we know how many?
I can't do fractions that fast.
Okay. But we don't know who answered what.
We will when we get the report.
Oh, we will? Okay. So, yeah, if you're going, also, you can just shoot us a message in the chat box. That's great that any of you all are able to go. And I created that poll and put in the love to who's paying for it because it's expensive. Registration has closed. We are excited to be there, and of course, no, you all can't be there. We'll pass along any of the great information we receive, and again, we'll keep an eye out to see who is going to be there with us. And Mary is going to give you all some updates on our conference coming up in October. Some people are saying they never got the poll.
I closed it off after that.
All right. We are holding our annual conference on October 4th through 6th in Dallas at the Omni Hotel Park West. And it's a joint conference, so it's not only presented by us at Texas Homeless Network, it's joint with Region 10 Education Service Center and the Texas Homeless Education Office, or THEO. So many homeless education liaisons from around the state also attend this conference, and it's a really great opportunity for the liaisons and the local homeless coalitions and other service providers to come together in person one time a year if they're not able to see each other regularly otherwise. And then, of course, we love seeing people from all over the state at this conference. Let's see, registration is open. I've included the link there. There are also a limited number of scholarships available. If people are in need of a scholarship to attend, there's an application link there. And also, people volunteer at the conference. So if you're interested in volunteering, there's a link to a form there. One thing that we're doing again this year is having tracks or a series of presentations targeted at special topics. And one of the tracks is for Texas BoS CoC members. So we want to know which topics would be most helpful to include in that track. And so we've provided a link to a survey there. You also got that survey link when we sent the invitation for today's meeting. It's a quick survey, and we've provided you lots of options about which sessions you'd like us to present, because we want to make these most valuable to you as well. So instead of us just picking which topic we want to present, we have offered you some to choose from. And again, it's a very just little quick list of some topics, and you can click yes on the ones that you want us to present. And that survey will close, that is today at 5 o'clock. So you still have a couple of hours to go in, and it really is a quick survey. And there's also an opportunity for you to offer another suggestion if we haven't listed it. But it's a pretty extensive list, so hopefully your topic will be on there. We also want to point out that the morning of Wednesday, October 4th, from 10 to 12, we will be holding our CoC general meeting, just like the one we're holding right now. But this one will be available not only via webinar, but it will be in person too in Dallas at the conference site. So for those of you who are coming to the conference, or those of you who live nearby and just want to join us for that meeting that morning, we would love to see you in person. Those of you who can't make it, though, can still join us via webinar as usual. For those of us there in person, lunch will be provided, so that's a bonus. And we will also be announcing the newly elected board members. So board member elections are coming up. We'll start that process in about July, so that by the October meeting, we will have our half of our board that is slated to be selected this year elected if things go as planned. So that's something to look forward to. So we do hope that you're able to attend our conference. There are different registration rates depending on whether you or your organization are members of THN. And just wanted to point out there is an early bird discount for members through June 30th. So check that out if you want to get in on the early bird discount. Got about 2 weeks to take advantage of that offer. And we hope to see you at the general meeting. It is again that morning, Wednesday, October 4th from 10 to 12. And then the conference itself starts at 1 o'clock that Wednesday. So you'll have plenty of time to go to the entire conference, even if you attend the general meeting on Wednesday morning.
Thanks, Mary. I'd like to point out we do have a hotel block, but it is limited, so if you do plan on going, I suggest move fast. The local ISDs tend to grab our rooms pretty quick. Again, early bird is open. We do offer 3 hours of ethics. If any of your staff do need ethics, we will be providing that thanks to Theo. Any of you that are Region 10 Tech Chef grantees, you should have received this information from Region 10 themselves, but there is a mandatory meeting for those folks as well that we do hold. We will be having our meeting between these guys, starting at 10, so we're somewhere right there. There's the member breakdowns. If you need any information about membership, you can email conference@THN. Jennifer can help handle scholarships, memberships, purchase orders, and registration problems that may arise. So all that information is right there. We will send all these links out. You've probably gotten them in the newsletter a couple times, but act now, act early. These prices don't last long, and neither do those rooms.
Thanks, y'all. I would just also stress again, if you're wanting to have input in the sessions we provide, just those balance of state sessions, please complete that survey. You all know we're trying to get creative about the way we can engage with you, and this is one of the ways we're able to reach all of you. And it's really important for us to hear your feedback. We want to cover things that you want to hear about. We've been doing this new resources at most of our meetings if we see things that we think would be helpful for you all in your communities. Caitlin is going to speak a little bit about the first one, without ID, homeless trapped in a vicious cycle. Caitlin?
Thanks, Cameron. Yeah, so I wanted to share with everyone a little bit about an article that I read recently. As probably some of you on the call might know, I may or may not be a little bit addicted to Twitter. And so I find a lot of articles that are related to my work in homelessness and our work in homelessness. And we found this one about how without ID, a lot of people experiencing homelessness are trapped in what this article from Pew Trust calls a vicious cycle. And it's something that we see a lot in working with homeless services, especially in the Texas Balance of State CoC. It can be really, really difficult for people to access mainstream benefits, to be able to get into government buildings in order to even apply for an ID, and even to access shelter or to get food from a food bank without forms of identification. It's kind of heartbreaking to see that people who are in these very dire situations are being denied access to necessary services because they lack some basic identification. So Let me see if I can remember where my notes are. Sorry, y'all. Whenever we do meetings remotely, scrambles my brain up. I guess to cut straight to the point, this article really hammered home, for me at least, why it's so important that we have low barrier shelters. Shelters are often surprised that we consider requiring ID to enter a shelter as being a barrier. And this is because a lot of folks that are very, very vulnerable and living on the street may not have an ID, and not allowing them access to shelter because they lack that identification leaves them exposed to the elements and at higher risk of dying on the streets, which is obviously something that we all want to avoid. We also recommend that homeless services projects like rapid rehousing projects and like permanent supportive housing and even transitional housing projects not require ID as an eligibility criteria. Now, before y'all freak out on me, I can hear it happening. We absolutely know that in rapid rehousing programs, you're working with landlords, and landlords may require IDs. And for those of you who have rental assistance component types with your permanent supportive housing, the landlords that you work with and that you partner with are absolutely required to ask for an ID. What we're suggesting isn't that the client never ever be assisted to get an ID and that they don't need an ID. What we're suggesting is that they be allowed into your program and have access to a safe place to stay while you are working with them on getting the ID that they need to obtain housing. One of the reasons why this article calls homeless trapped in a vicious cycle is because you often need ID to get ID. And that can be especially difficult for people who live on the street, who often have their belongings stolen, or who misplace things, or who just never had it in the first place because they came out of an institution, or because they are coming out of an abusive relationship where they never had access to their own ID anyway. So that just continues to be a barrier that we see pop up across the state and across the nation. We aren't special snowflakes in Texas. Across the nation, we see this continuing to be an issue for people experiencing homelessness. I'd encourage you guys to give the article a read. It's pretty short. I found it to be very engaging. And see what you think. There are some suggestions in there about how to partner with DPS or your local police department to expedite getting people experiencing homelessness an ID. So I wanted to put it out there to our current attendees. I know we normally have problems trying to unmute people, but if you want to maybe submit a question or use the raise your hand function, if anyone wants to share about any special partnerships that they have with their, I guess, governmental entity, be it a DPS, DMV, police department, to help people get IDs quickly to be able to help them end their homelessness as fast as possible. Is there anyone on the line who would like to share?
I'm looking now.
We really need to get Jeopardy theme queued up.
I almost pulled it up on my phone today. CB, I'm not seeing anything.
All right. Well, maybe we'll put some feelers out and talk about it at the next meeting. I just wanted to also point out that nowhere in the ESG regulations or in the CoC program does it require participants to have an ID to be eligible for the project, and it doesn't require you to keep an ID in a client file in order for the client to receive assistance. So just know that that's not something HUD is expecting either. So they have actually removed that barrier because they see that it has continued to be a reason why people are not housed in a timely manner, or why they're rejected from projects that are honestly meant to serve them. So just know that that isn't something that the federal government is requiring. So if there is a local ordinance that you guys have in maybe a city level or a county level ordinance that requires ID for certain funding sources, feel free to let us know if you're interested in working with them on lowering that barrier, and I'm sure we would be happy to consult or work with you all on making sure that people experiencing homelessness have access to the services that they need regardless if they have ID. That's it from me.
Thanks, Caitlin. Couple other resources we wanted to share with you all. HUD posted some new resources on youth homelessness, and I will not be doing what Caitlin did and going through all of these, but we wanted you to know that they exist, and they, again, are pretty great. Some of them are quite broad and we'll take some tailoring to your community, but we're excited to see some more resources and especially some models on rapid rehousing for youth. And these are the types of things we'd really encourage you all be reviewing and looking at your local level to see how you can implement those. The role of emergency shelter in the housing crisis response system, that's a series that NAEH has been doing. I think we've pointed this out to y'all every time that they have one, but just wanted to let y'all know that they've added some additional resources, and again, we think these are pretty fantastic. And the last one I mentioned earlier is a report from the NLIHC on housing cost and housing affordability, which is, well, there you go. It's not surprising, but always, seeing the numbers, I was going to say in black and white, in blue and white. In this case, we know we have an affordable housing crisis in this country, but they've put this together, and as Craig has pulled up Texas, you can pull it up by state and or county. Pretty interesting information and good to know as you are advocating for affordable housing in your community, and a resource we wanted to let you all know was out there and had been released.
You can also use this information for your ESG and your, actually a lot of your other contracts. You can actually use some of this information for if you're not already using census data or American Census Bureau. It's a good repository to take to your local governments, because each county has its own report card. They spent their time and did their homework, and it is out there for you to use. And if you're not using it, you're losing it. I don't know where this comes from.
I feel like I have the game show host thing going on today. And back to just what Caitlin was talking about, if you all have figured out any kind of creative solutions in your communities, I know that finding discretionary funding to help folks with people with things like IDs could get challenging sometimes. In certain communities, if you've found a good way to get around that or a good funding source for that, we'd love to hear about it. In addition, we are always looking for other potential spotlights for these general meetings. If you have ideas or know of someone who you think would be good for a spotlight, please feel free to send those in. I think I would email Mary with those ideas. Our next meeting is July 12th, same time, always. Again, going to be a busy summer with board elections and the NOFA and ESG. We'll keep you all posted. As soon as we know about the NOFA, you will know. And remind everyone again about mandatory HMIS assessment training. If anyone has questions or comments before we wrap, please feel free to raise your hand or type those in to the chat box.
Got up for an hour. Stephanie had up for a second.
We haven't seen anything pop up yet, and just wanted to say again.
Where are the handouts? The handout, something happened with the PDF when I was uploading them. You will get all the materials we go over as usual with the recording shortly after this meeting. I tried to upload them at the beginning of the meeting. I got 3 of 5, but I've been seeing messages that nobody can grab them. I won't forget about you, I promise. We will send everything out.
And I just wanted to throw out a just big thank you to all of you for all the work you're doing in your communities. As you all know, we wish we could get out there more, and every trip that I go on, I'm just always reminded and remember how challenging the work is that you all are doing out there. And it helps me remember why we are all here, and we're trying to get people into housing and make sure nobody dies on the street. And thank you for the work that you're doing out there. It looks like I have questions. Okay, Craig's got those. And then just a big sweet thank you from Holly Bates, and we send it right back to you all. Y'all have a great rest of your week. You know where to find us if you need us, if you have questions that you think of after the meeting, which is when I'll be thinking of all the things I wish I had brought up during the meeting that I didn't. Please feel free to reach out, and we will talk to you all soon. Take care.